Ectopic pregnancy. A woman becomes pregnant when one of her eggs is fertilized by sperm, normally once an egg has been fertilized. Sperm travel through the female reproductive system and into the fallopian tube, where they eventually join the egg. Only one sperm can fertilize the egg. The newly fertilized egg then travels along the fallopian tube toward the uterus, where it can implant and develop until birth. In some cases, however, complications may cause the egg to implant in areas other than the uterine lining. Such an occurrence is known as an extrauterine or ectopic pregnancy. In an ectopic pregnancy, the fertilized egg implants itself outside the uterus because damage, scarring or distortion of the fallopian tubes leaves it unable to pass easily into the uterus. Implantation in a fallopian tube is called a tubal pregnancy, or the egg may implant itself in an ovary, the abdomen, or the cervix. Whatever the site of implantation, an ectopic pregnancy cannot continue to birth. If the embryo continues to develop, the tube or organ containing it will eventually burst. A potentially life-threatening emergency. The risk of an ectopic pregnancy is increased by tube infections, surgery inside the abdomen, fertility medications at the time of fertilization, and a prior ectopic pregnancy. Ectopic pregnancy is usually identified during the first 5 to 10 weeks of pregnancy, causing symptoms of abdominal and pelvic pain and vaginal bleeding. It may be confused with a miscarriage. How the developing cells are removed depends on their location and size.